Medical news from MedRxiv. Mendelianization, concentrating polygenic signal into a single causal locus. The introduction of Mendelianization, a novel algorithm, has the potential to revolutionize the field of psychiatry by concentrating polygenic signal into a single causal locus, thereby enhancing our understanding of complex disorders such as depression and alcohol use. This breakthrough matters because it may finally shed light on the mechanisms by which numerous genetic variants directly contribute to the pathophysiology of these conditions. By simplifying the genetic landscape of complex disorders, Mendelianization could pave the way for more effective treatments and interventions. Complex disorders like depression and alcohol use disorder pose a significant challenge to researchers due to the sheer number of genetic variants implicated in their development, with the number of implicated loci growing exponentially with sample size. This has created a knowledge gap, as the interplay between these variants and their collective contribution to disease pathophysiology remains poorly understood. Previous studies have struggled to provide a clear understanding of the underlying mechanisms, highlighting the need for innovative approaches like Mendelianization. The concept of Mendelianization is distinct from Mendelian randomization, and its development was necessary to address the limitations of existing methods in deciphering the genetic basis of complex disorders. The Mendelianization algorithm was developed and tested using a robust methodology, which involved learning weighted combinations of outcomes to concentrate association at one locus. The researchers proved that this locus is causal under 4 structural assumptions natural to genetic data, providing a solid foundation for the method's validity. The algorithm is capable of handling partial sample overlap, providing calibrated hypothesis tests, and mapping coefficients to interpretable scales, making it a powerful tool for genetic analysis. Furthermore, the method quantifies the degree of Mendelianism using summary z-statistics alone, allowing for the evaluation of the genetic basis of complex disorders. The key results of the study demonstrate the effectiveness of Mendelianization in enhancing statistical power to detect Mendelian symptom profiles, even in heterogeneous disorders like major depression, generalized anxiety, and alcohol use disorder. The algorithm's performance was evaluated through experiments, which showed promising results in terms of its ability to concentrate polygenic signal into a single causal locus. The specific numbers and effect sizes were not provided, but the study's findings suggest that Mendelianization can significantly improve our understanding of the genetic basis of complex disorders. The researchers also reported that the method can be applied to summary z-statistics alone, making it a valuable tool for genetic analysis. In addition to its primary findings, the study also explored the potential applications of Mendelianization in subgroup analyses, although the details of these analyses were not provided. The clinical significance of Mendelianization lies in its potential to transform our understanding of complex disorders and guide the development of more effective treatments. By identifying a single causal locus, clinicians may be able to develop more targeted interventions, and guideline implications may include the incorporation of Mendelianization into genetic testing and counseling protocols. The study's findings have important implications for clinical practice, as they may lead to a shift in the way complex disorders are diagnosed and treated. However, the limitations of the study, including the need for further validation and the potential for biases in the algorithm, must be acknowledged and addressed in future research. Overall, the introduction of Mendelianization has the potential to revolutionize the field of psychiatry, and its impact will likely be felt in the years to come. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.